Yeah, what seems to be the problem, John? You've got a sore throat, okay.
Advanced nurse practitioner Jo Evans is working an out-of-hours shift in York, delivering primary care services between 6 in the evening and 8 the next morning. She works alongside a GP. The service has been contacted by a 21-year-old patient suffering from a persistent sore throat, and it's getting worse. A telephone conversation gives Jo the information she needs to decide what action should be taken. In this instance, the patient's invited to attend the service for a formal checkup. The unusual thing about this arrival is that the patient is coming to the Accident and Emergency Department at York Hospital to access a primary care service. It's all part of a new way of working being implemented at several sites across North Yorkshire.
Golf ball, aren't they? Yeah. It actually looks as though you've got a throat infection there. More than likely is a bacterial infection.
The aim of the scheme is to better integrate GP and nurse-led out-of-hours care services with accident and emergency services. To do this, primary care services are being relocated to A&E departments.
The PCT with this is trying to look at developing a service which brings the skills of the A&E staff with their diagnostic backup with the primary care staff which have traditionally worked in out of hours. Those are GPs who are skilled and then nurses who are skilled in looking at out of hours problems for patients. Patients have traditionally accessed services out of hours by either attending A&E or by going along and phoning their GP and getting the details of the out of hours service. But some of those problems can be dealt with by either the GPs or by the A&E staff. So by bringing it all together within one site, it allows patients to access that and have a comprehensive range of services at their fingertips.
The system is being introduced at sites across North Yorkshire, including the Friarage Hospital in Northallerton. Samit Mitra is an A&E consultant at the Friarage. He believes the system has advantages for both his own work and the work of primary care services.
For example, in our area, if the GP is out on a home visit, these patients may have in the past need to be waiting for a GP to come back. During the new system, hopefully these patients will be seen by our A&E doctors. If our A&E service gets very, very busy and the GP service isn't as busy, the GP doctors will hopefully see our patients, and there's reciprocal working going on.
There's a few options here. That sounds like you're doing the right things at home and maybe you would like to see your own doctor. Alternatively, we could have a look at that for you this evening and you could come down to the out-of-hours service.
And the advantages can be seen on both sides.
What we'll try to do between the work that we're already doing is to work within the A&E department and with the nurse that's triaging their patients coming through to pick up some primary care calls, such as children that have woken up irritable, earaches, and people that maybe have got some insect bites and things.
The main benefit of this service is that patients don't have to think so hard about where they go for different ranges of treatment. They go to one place and then the clinicians looking after them will sort out how best to look after their needs.